Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked?
Broken neck. No, really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new unstable neck fracture. Checking his initial x-ray, we see that it was there prior to the operation. After questioning the patient, he said that on his way to the hospital the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately, he passed away about 2 weeks later due to the cancer.
Patient was lactating but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had been weaned for 14 months. Sent her immediately for a brain scan, brain tumor. She had surgery a week later to remove it and is doing very well now. Edit. Wow, I didn't think anyone would even read this, or I would have explained better, tried to sound a bit more professional. I did not do any of the follow-up care. She left my office with a referral for an MRI and a referral to an endocrinologist, who took over care. Also, please, if you are concerned about your health in any way or are not happy with your doctor care, obtain your medical records and bring them with you to a different doctor. Don't solicit medical advice from strangers on the internet that know nothing at all about your medical history. That is very dangerous to your health.
My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times, was brushed off and told not to worry about it. Derm even burned off a nodule that was bothering him, at his belt line, but repeatedly said it was nothing and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist, since our experience was so negative. Next, derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, triage and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so beep patronizing with our concerns and shove his face deeply into his own ass.
I suppose I have one for this as a resident doctor. We saw a kid in the eMERG for difficulty walking. He had been slowly losing the ability to walk over months, and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip. Then the other hip. Gave some Zofran etc. Turns out on exam he is blatantly ataxic, bad coordination and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me and I'm not even good at this yet. Did a CT scan. Big ass tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain and he went to ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. Edit. Thanks everyone. The history was that he really declined further over the last few days, prompting the ed visit, so he looked really bad for us, but I'm not sure what he looked like before. To any med students reading this, 1. Do an exam. 2. It's okay to cry sometimes.
Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him, I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful, not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinical mass, suggestive of lymphoma. Sadly, I don't know what happened to him.
As a patient, my eyes were hurting and I kept going back to my eye doctor, who insisted that the problem was that I wasn't cleaning my contacts properly and just kept giving me harsher and harsher chemicals. It got to the point where I couldn't open my eyes fully in a room with the lights on, and I hadn't worn contacts for months. Finally, after a year, my mom forced my dad to take me to a different doctor. Literally, he met me in the waiting room, looked at me with his naked eye, and said, "You have a raging eye infection." A month of antibiotics and the infection was gone, but there was so much scarring and damage it was 20 years before I could wear contacts again. Edit. Getting this question a lot. I was a kid at the time, I didn't know the difference between an optometrist and an ophthalmologist, and it was over 2 decades ago. I do not remember if I ever knew, sorry I can't tell you. A lot of people are saying that optometrists are basically just for routine checkups and getting glasses or contacts, and if something is actually wrong and you need a diagnosis, go to an ophthalmologist. Update, I'm now getting pushback on this too. Apparently the distinction between optometrist and ophthalmologist is less drastic than some of the earlier people implied. Again, the only thing I personally recommend is that you do your own research and come to your own conclusions. I don't personally know if that's true or not, but feel free to do some research. It's a thing several people have said now. I've only gotten the one troll so far showing up to tell me he is 100% sure I'm lying because that's clearly what people do for fake internet points, and he will not have it, which seems low for a Reddit post. So I'll take that as my good fortune of the day.
Not a doctor, but a friend of my mom's went to an ophthalmologist for an eye problem. During his exam, he asked her, "So how long have you had MS?" That was the first she was diagnosed. She had been battling various MS symptoms for a couple of decades without a diagnosis.
There was a story pretty recently in the hospital I work for, where a cardiologist in the ER was doing a rather difficult night shift, and started feeling lightheaded, dizzy and fatigued. Given how intense those shifts are, 26+ hours, sometimes multiple times a week, nobody thought much of it, and the doctor in question went to catch a quick nap in the staff room. People just passed by him in the staff room every once in a while, but they just assumed the poor guy was exhausted and let him rest. He was dead for several hours by the time someone realized something wasn't right.
One that comes to mind is when I was a resident, the ED doctor wanted to admit a mild septic patient with a UTI. I review her labs, and knowing that she is a diabetic, it was obvious florid DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive IV fluid rehydration. She was just in the ED hallway with no medications at all, looking like crap.
Not a doctor, but actually the patient. I had a doctor prescribe me birth control. While in line to pay for it, I'm reading the paperwork that comes with it and learn that another medication I am on permanently and everyday completely voids out any effect the BC would have. I went back to the pharmacist and asked about interactions, and he says I may have side effects. I ask which ones, and he says pregnancy. Pregnancy is not a side effect. It is a lifelong commitment. Then I call the doctor and ask why they would prescribe something they knew wouldn't work, and she said, "But you asked for BC." Like, yeah I did, but I wanted some that would work. Silly me for not specifying that.
Patient getting anxious about numbness in his hand. It's getting more frequent, and I don't want to live like this. It gets me freaked out like my hand's not there. They assumed the person was suicidal and having symptoms of panic attack, elevated breathing rate, tingling/numbness in hands. They did a CT because I requested it. There was a lesion, they blew it off. MRI showed it was glioblastoma multiforme. Edit, clarifying, it was missed by the ER physician assistant. The MD supervising them never spoke to me. Not even sure if they reviewed the case.
Once when I was a medical student on surgery rotation, in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen, and saw his common bile duct was like 3 times normal size, could drive a truck through it. About that time, next set of vitals, his temp was 103 F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency.
I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. Sad face.
In residency, I saw a cardiologist miss a STEMI heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died and he was in cardiogenic shock. Basically, his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily he made it through though.
Not a doctor, but I've been dealing with abdominal pain since a child, countless ultrasounds, doctor appointments, visits. I was always told it was in my head. Recently had surgery for something unrelated. During the surgery they had to free my appendix that was stuck to my abdomen wall, and just the tip is healthy at this point. I've been suffering for years with a mild case of appendicitis, and my body was pretty much just absorbing my appendix. I will have to go back to get it removed at a later surgery because it was so stuck. All they could do was free it, and they didn't want to risk it at that point because it was going to cause more pain. So that was cool to find out.
Not a doctor, not even a nurse. While working as a CNA on an ICU step-down unit, I noticed my patient was acting strange, asked her a few questions, got some questionable answers. Thought it might be weird, as she couldn't really answer questions other than, huh, and uh-huh. Her gait was weird, like a trot rather than a normal walk, plus she was leaning. I was training another CNA and I was like, no matter what you do, if you see something, notify the nurse and chart that you notified her. The patient was having a major stroke and the nurse was too far up her own ass and her own phone to do an assessment. The woman had to go to rehab and was not a candidate for any stroke reversing drips, as I had charted that she seemed off 8 hours before. The only reason anyone caught it was because the night shift nurse insisted on bedside report. The nurse I had been working with yelled at me, stroke? Like I hadn't been notifying her of symptoms all day. Edit, thanks for all the kind comments. Just remember to be kind to your local CNAs and try to answer some of those call lights. You'll never know how much we will appreciate and respect you for helping with the basics. I'd also like to add that in theory, anyone can call a rapid, but not every institution supports the policies they make. As I commented below, at this same institution I had a patient with a blood sugar in the 30s. Could not get a hold of the patient's nurse or the charge nurse. Called the rapid, got scolded for not giving the primary nurse the opportunity to treat the patient first. I saw this type of scolding happen at least 4 times before this instance, so the message was that if a nurse doesn't call it, then you'll be pulled aside and reprimanded for doing so. It's a pretty beep hospital and I no longer work there.
MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure.
I'm the patient in the story. When I was a toddler and started walking, my extended family noticed that I would waddle a lot. My parents didn't really notice it because they grew used to my funny walking, but my grandma and my aunts that saw me so much less often insisted that I had a limp. So my mother asked our pediatrician about it and he reassured that it was nothing and would fix itself when growing. 1 year passed and it didn't fix itself, it got more noticeable. My mother asked again to my doctor, she asked for an X-ray to make sure everything was fine and the doctor bite her head off for wanting to expose me to the rays. He insisted it was nothing but referred us to a specialist anyway. The specialist suggested my parents put some wool around my leg that had the limp. Because wool would warm it up and speed up the growing process. Right, my dad finally had enough. It was summer and my regular pediatrician was on holiday. His partner visited me because meanwhile the limping became really bad and my parents wanted another opinion. The new doc measured my legs. There was a 4 or 5 centimeters difference between the 2 legs. They sent me to a specialistic children's hospital to get it fixed right away. I had severe dysplasia, so severe my right hip didn't have a socket for the femur bone. 3 years and 3 surgeries later, months of physiotherapy to learn to walk again, I was normal. If the second doc didn't catch it, I would have grown up disabled. He split up with his work partner, the first doctor. Second doc is now my daughter's pediatrician's smiley face.
Life pro tip. When seeking a second opinion, don't tell them it's a second opinion. You want a second first opinion, not a confirmation of the first opinion. I have been to multiple doctors who would not contradict the diagnosis of another doctor, even with test results that ruled out the initial diagnosis, or confirmed a contrary diagnosis.
They told him go home, it's nothing to you. When he came to me we barely saved him, he had a ruptured appendix.
I'm a PT and patient was referred to me with low back pain, and after evaluating him I referred him to the ER for suspected kidney issues. He had a kidney infection.
Not a doctor, but I was in pain for days. My primary care doctor missed the kidney stones.
May your day be filled with joy and happiness. And please remember to like, share, and subscribe for more quality content every day.